Daniel, can you hear me?
Can hear you loud and clear.
Okay, go ahead. You have 5 minutes.
How's my audio? Okay.
Yep.
By the way, on that school climate survey, I tried to, there's a copyright threat when the parent looks at that survey, so they can't actually discuss it or share it easily. Anyhow, off topic, but I just thought to threaten parents with trademark infringement for publishing that survey, that was pretty weird. My name is Dan Fryhead, as most of you know. I do some advocacy on Twitter, mostly, under Lion Advocacy. I'm up to 38,300 followers. I get around 78 million views on my posts. I wanted to talk today about the issue of vaccine injury support. Because I was looking at the budget that the board has approved, or is on the verge of approving for other items on the budget, specifically the sexual health clinic, which is getting 2.8 million. So it's just about, for my presentation today is really just about how to manage priorities and how to manage the queue, because there are people out there, Torontonians, who've been waiting 4 to 5 years for compensation for vaccine injuries. And these are not myths. These are, in some cases, they're often verified. This had been managed by the federal government from the beginning of the pandemic, or from December 2020 up until April 1st of this year, 2026. It was being managed by a private contractor who was processing the injuries, or supposed to be processing them, but the contractor was really having issues getting through them for some reason. I mean, I think I know the reasons, but seeking a lot of documentation, direct control of the documentation, so asking directly from hospitals and physicians to have the documents go directly to the assessor. And so there are a lot of people's injuries didn't get processed. They just never went through. I actually spoke to people at the Vaccine Injury Support Program, employees. There was a lot of turnover. There was I think I mentioned this to this board, but one of the staff was apparently having mental distress. I think the point is, now the federal government decided to take it over, or that's how they pitched it. They said, we're going to take it over from this private contractor because they don't seem to be doing a good job. And what I've just learned a week or two ago from a young lady who advocates a lot on Twitter, her name is Kayla Pollock, but that this new processing by the federal government, they haven't appointed any medical advisors to actually look at these claims yet. And that's a major flag. So you've got people 4 or 5 years out, some with serious catastrophic injuries that have mobility issues now, that are in constant pain, that need physiotherapy, that need medication, and then medication's not cheap. They're struggling to get by. And so when I see these amounts that are being spent on birth control counseling and low-cost birth control, emergency contraceptive pills, IUDs, free condoms and lube, vaccines for STIs. I mean, all that's important, but I just wonder if there's a better way to manage the queue. Like I say, these people have been reaching out to me for years. I couldn't talk about it on internet because I was censored. If I mentioned the word vaccine or injury in the same sentence, for some reason the AI or the censors took down the video and made it very difficult to discuss. The reason why you're not hearing more from vaccine injured people in this Board of Health is because they had difficulties mobilizing. They formed Facebook groups that were taken down. Our friend Zuckerberg at Meta acknowledged under oath that he had been working with the U.S. government to restrict the mobilization of people injured by the vaccine. That's a serious problem that's going to need addressing at some point. But the point is, the only reason you're not hearing more from people who've been injured by the vaccine, is because some of them are in a situation where they're not able to get down to the Board of Health or to have the energy to speak. Thankfully, I still got a bit of energy left in me. And that's what I'm doing. I was contacted early on by a conservative MP out west about constituents in his riding, what to do, but how to help people with vaccine injuries. The Board of Health has a unique opportunity now with some of the budget items. I'm just respectfully requesting a reconsideration of priorities and queue management. So in other words, we've got these people in the queue. The Board of Health can actually work strategically with Public Health Agency of Canada to process these claims, streamline them, and get people the help they need.
Okay. Thank you very much. Any questions of the Deputant? Seeing none. Thank you. Councillor